Hello, hello. Welcome to this episode of the Rogers Radio Podcast. I am your host, Alyssa Rogers. And today's going to be a fun one because we have three outstanding individuals that are going to talk to you all about health and wellness and what you can do to take care of yourself. And we're in the holiday season. We're probably not being the healthiest right now. And we're going to talk about how we can get healthy in the new year and the options that are out there for you. So going first today is Heather Satterfield with Gateway Health. Hello.
Hi. Thanks for having us. We're super excited to be here.
Yes. So I'm excited for you to be here. I always love when I have individuals on to talk about health and wellness and how we can take care of ourselves because there's so much information out there.
For sure, yes.
And it can be so overwhelming. So I need you to simplify it a little bit for us.
Sure.
Especially me. So tell us what you do at Gateway Health.
So I'm the Director of Sales and Marketing. So it's myself and Kedra Walker. We are the sales and marketing team. And what we do is we travel around and we meet with employers and brokers in certain areas, including the Halifax, South Boston area. And we talk to people about what Gateway offers. So if you're not familiar with us, we're a third-party administrator. So we manage self-funded benefits, health benefits for large employers in the area. So that to us, that's 100 enrolled lives and over.
Yes.
So then also we have healthy solutions that can be combined with our TPA product or it can be sold separately. And for healthy solutions, we can do groups that are around 50 enrolled lives and over. And what we do is we bring our own nurses on site and do the screenings, and the employees have a counseling session with the nurses before they ever leave their counseling site to see what things look like and talk to that nurse about setting goals. So we go out and tell people about how wonderful our Gateway products are and try to bring them on board so that we can start helping them.
So you're based in Danville, is that correct? And been around since 1995?
Yes, we are 30 years old next year, so we are obviously doing something right.
Yes, you are. And I mean, how awesome is that to be able to go into these businesses and talk to employees about their health and help them get healthy?
Oh, it's wonderful because we're so passionate, and you'll hear from them as well how passionate we are about this program. We really feel like, and we see how much it helps people. You know, in the screenings year over year, you can see the changes that the employees make, and coupled with the nurse coaching that they get, it really makes a difference in their life. And they have such a good relationship with our nurses that they even call them to talk about personal things, you know, their grandchildren or what they're doing next week or something like that. And all of that together makes for a fantastic program.
And this is in addition to health insurance policies and plans, is that correct?
Yes, this is something that's extra that a company brings in. And we tell people, you know, this is something your company is doing for you, not to you. So we really want to motivate them, and our nurses are trained in motivational coaching to further that process so that they can be around for whatever goal it is they want to be around for, you know, their children graduating from high school, their grandchildren getting married, whatever is important to them, we want to make sure they get there.
That is awesome. Yeah. And, you know, it can be so overwhelming. We talk about it in the office. Kenny and I have talked about going to doctor's appointments like, I don't know if I want to go or do I have time for this? And you come to them.
Exactly. We do. And it doesn't matter shift differentials or anything like that, because we want to make sure they're fasting so that we get the most accurate results. So our nurses have been on site at, 2:00 in the morning, whatever time they need to be to make sure that happens. And, it is overwhelming. And a lot of times the nurses, when they talk to people, they feel that, they feel that stress. And so what they do is just really try to tee them up in their counseling sessions, further past the screenings. When you go to your doctor, ask these questions based on what's going on in your health already. Ask these questions, and then you can find out from the doctor how you need to move forward, with whatever they need to do.
Wow.
Yeah. That is so many aspects of it. We just love it, and we just love to tell people about it.
I feel the love that you have for your position and what you do for Gateway Health. How long have you been with Gateway Health?
11 years.
11 years.
11 years, yeah.
Congratulations on that.
Thank you.
And I can feel the love, like I said. So what is your favorite part of what you do out of everything?
Oh, gosh. It's talking to people, building those relationships. I tell Kedra all the time, COVID about killed me because I am not one to sit behind a desk and sit behind a computer. I want to be out talking to people, meeting people like you, and just telling people about how we can help them and how we can move them forward towards what they want to do in their life. Yeah.
That is so awesome. And thank you for everything you're doing for the community and for these employers and bringing this to them. And if they want to get involved, how do they get involved if they don't know about Gateway Health?
Oh, gosh, we have a website, gatewayhealth.com, but you can also contact us you can reach me. I have my information that I'll give you as well.
And we'll include it in the description.
Yeah, that would be wonderful.
Yes.
Just reach out. We'll answer all your questions. There's nothing to be afraid of. No, this is not people are like, this is a drug test. No, it's not. This is a benefit from your employer that they're giving you. And a lot of times there are incentives involved and that's even better. So just reach out. We'll get all the information that we need from you and then we'll move forward.
And if we have someone that's listening right now and they work at a place that has over 50 employees or over 100 employees and they're not sure that this is offered there, do they go to their HR department?
Yeah, that would be optimal. Go to your HR department, talk to them about it, give them our information, and then if they have a broker, most likely the HR person will go to the broker and say, hey, can you please reach out to Gateway? We're very interested in this program.
So awesome.
Yeah.
Well, thank you for everything you do.
Thank you.
We're
I really
gonna
appreciate it.
talk more. So let's bring on the next one.
Yeah, Katara's up next.
All right. Sitting here with Katara Gunter. And I mean, you're the one going into the businesses and helping these employees reach their goals.
Yes.
So what do you do for Gateway Health?
Okay, so I'm the nurse manager for Healthy Solutions. What I do is we do go on to on-site health screenings to not only help the employees have a biometric screening, but also give them a sense of awareness of what preventatives they should be having and how to better manage their care. So when we go in for health screenings, we do point-of-care testing or venipuncture testing, where we look at their cholesterol panel as well as their glucose panel, do their height, weight, blood pressure, and also provide consultations so they'll know what I'm looking at as far as my numbers and how to manage my health.
Oh my gosh, that is amazing to be able to go to work and you get to get all of that taken care of and see where you are. So, okay, if they're healthy, that's great. It's like, hey, thumbs up, everything looks good. Like, keep doing what you're doing because you're crushing it. But let's say a couple of numbers are off. What does that look like when you're seeing that on your screenings?
Okay, so when we're having that consultation, and say, for instance, their blood pressure may be elevated, we may look at that number and let them know of the current guidelines. So we do look at our current guidelines each year to make sure that what we're coaching falls in line and what your physician may be telling you. So we may let them know that, hey, your blood pressure, it falls in this risk factor, which we do a low, high risk, or moderate risk stratification. And these are ways that you can improve it. So maybe instead of eating processed foods every day, maybe cutting it down to maybe once a week and incorporating more vegetables in your diet, watching your sodium.
Wow. And that is a really big thing in our society and culture today is all the processed food and the fast food. And now we're in the holiday season and it's all the baked goods. And I mean, how do you say no to that? And so what is your advice to anyone this holiday season?
Moderation. So we're not telling you cut back on it completely because it's definitely hard to do. Who doesn't like cakes? Who doesn't like pies?
Give it all to me.
But moderation is best. So we definitely, try to encourage individuals and speak from our own selves. I'm not the best as far as watching my sweets, but what I do is moderation and also making sure you try to exercise a little bit afterwards. That's always good. So, just letting them know that, we are people too. So we understand that, you may have issues here with your health, but these are ways that we can better it.
Yeah, and Heather mentioned the kind of, coming in and you're kind of consulting them and taking them through that process, and that people reach out to you asking you for advice. How do you handle those situations, and kind of what does that process look like when they just kind of want to talk to you about what they're doing or have questions?
Yeah, so most of the time, most of our calls, we're basing them from the consultation time on a every month, every 3 month, or every 6 month phone call. So when we're calling them, we're just seeing how they're doing. How are you doing as a whole? Was there anything that you were scared to ask your physician about? Was there anything that you didn't quite understand, and just providing them with that education there? Also, when they do call in, we enjoy talking with them.
Yeah.
We have a great team of nurses, seasoned nurses who also have that good fountain of knowledge on telling you, well, these are the ways that, you can improve your health. So we enjoy what we do, and just working on that side of preventative care. So preventing them from reaching a chronic disease, or showing them ways on how to manage those chronic diseases better.
And I mean, how long have you been with Gateway Health?
I've been with Gateway for 5 years.
5 years.
Yes.
And again, I had never met any of you before today, and I'm so serious, and I just want everyone listening to kind of feel what I'm feeling right now. I feel love for your patients. I feel like you care about everyone and really want them to take charge of their health to be healthy for many years to come.
Yes, so definitely that's what we strive to do, is just letting people know, these are the things that you can do to improve your health, making sure they're getting their screenings, their preventive screenings, and just, taking ownership of their health and just helping them along the way.
Well, thank you for everything you do.
Well, thank you.
You're very welcome. And I mean, we're talking about customer service and the love for it. And so I'm going to bring up another customer service focused, loving person. Let's go. Sitting here with Kedra Walker. Thank you for being here.
Thank you for having me.
And I mean, what I'm feeling right now, like I just said, is love and care for the people that you serve.
Absolutely.
Tell us what you do for Gateway Health.
Okay. Well, I'm the marketing and sales coordinator for Gateway Health. I go out a lot with Heather. We spend a lot of time together meeting with brokers and employers and HR managers, just going out just to tell about our product. So I love being out there, giving people the knowledge about what we do and how we can better help them with their health and things of that nature. So
and it just really feels like you're an advocate for employees that work at all of these places. Like, you want to advocate for their health and make sure that these employers are providing these options.
Yes.
So tell us a little bit about what happens when you're going into an employer and talking to an HR director, and kind of how you put all the plans out there and give those options.
All right. So we tell them exactly what we will need to provide them a quote, and just basic information like a census of their employees, date of birth, zip codes, things of that nature. And we take all that information and we compile it, and we're able to go in and see, based on, that information, how we can provide the quote for them, the pricing. We get a lot of information from them based on, where they live. So we can see, if we need different nurses for different shifts, things of that nature. So that helps us to be able to provide them a quote.
And you're providing all of this, you're making it so simple. You're really taking all of that, as we build the business here, it can be very daunting to have to do all of that stuff, and you're doing it for them.
We do try to take that off of the employer, off of the HR managers. We work for them when we're trying to better their employees' health, so we can provide those services for them.
Yeah, and making sure that you're talking to the brokers too, because that's a whole nother side to it that is being taken off the employer's plate, because there's a lot that goes into that too.
It is. is. It is. We do not want to get in trouble. If the company does have a broker, we would like to talk to that broker. We don't want to cross any lines.
Right.
We want to work on building those relationships.
Yes.
So.
And it sounds like you have a lot of relationships with brokers and employers. And so you are able to make that easy. How long have you been with Gateway Health?
I've been with Gateway. I just celebrated my 9th year anniversary, and I love it there. Every day is something different. I love meeting new people, talking to new people, and, just letting them know what we do and who we are.
Yes.
Getting our name out there.
And so what advice do you have? We're going into a new year. Employers are kind of planning for 2025 right now and what they're going to do for their employees in the new year. What advice do you have to anyone that is watching right now that says, okay, I want to offer this?
I said, come give us a try. We can see how it goes that first year, and I'm sure you'll love it.
Yes.
But we say that the employers come for the savings, but they stay for our service. We have a very dedicated account manager, customer service team, client account managers will also work with you, and we're also there to help along the way as much as possible that we can.
I feel the love. I am telling you, I feel the love. It has me fired up because I want to do amazing things for our team in 2025. And I feel like, every employer, or if you're an employee at a place and you want to bring Gateway Health there, talk to your HR department,
Please do.
Talk to others, and do this, because bringing it to the employer, bringing it to that workplace that they come every day and being able to offer these solutions to them, I think is fantastic.
Absolutely.
I appreciate everything that all of you do. And I can feel the love for what you do every day. And I just appreciate it because, we all want to get healthy in 2025.
Absolutely.
We're going to thrive in 2025.
Yes.
And so thank you
You're
for
welcome.
being here today. And all of the information is in the description. I'll give you links. I'll give you contact information. So if you are interested, it is right here. So click below. You want to get to know them because it's just a huge benefit to all of our surrounding communities. And I want you to take advantage. So everyone, get healthy and thrive in 2025. And thank you.
You're welcome.
And thank you to everyone for listening to this episode of the Rogers Radio Podcast. I can't wait to talk to you next week. But until then, please rate, review, and subscribe and tell us what you think. And we want to hear your feedback. Talk to you next week. Bye.